pages of Vaika Vedanta. He actively delivers lectures on Rasoushadhis and practices Ayurveda in Bangalore. So with a round of applause, let us welcome Shri Pavan Kulkarni.
Wadeyar sir, Managing Director, Pavan Pharmaceuticals, a renowned authority in the field of Ayurveda. With his profound knowledge, sir has explored the clinical efficacy of Rasoushadhis across various therapeutic domains. Sir's research and insights have added immense value to the field of Ayurveda. We are very honored to have you here with us, sir. A very warm welcome to you.
Dr. Shrinivas Wadeyar, a highly accomplished Ayurveda practitioner, teacher and researcher. Dr. Wadeyar holds a BMS degree from Ayurveda Mahavidyalaya, Vijayapur, where he was awarded the prestigious Dr. P.B. Jayade and late Dr. S.M. Kartikeri Memorial Gold Medals for securing the first rank at Karnataka University, Dharwad. Dr. Wadeyar comes from a distinguished Ayurveda lineage as the grandson of Vaidya Bindu Madhav Wadeyar, a pioneer in Ayurveda who founded Ayurveda Mahavidyalaya and Pavan Pharmaceuticals in Vijayapur. Following in these illustrations footsteps, Dr. Wadeyar has made significant contributions to the field of Ayurveda, including the presenting research papers, training practitioners, and conducting community health awareness programs. Sir has trained over 20 practitioners in pure Ayurveda at Maitri Ayurvedalaya, Vijayapur, and leads Pavan Pharmaceuticals, known for producing high-quality Ayurveda medicines. Dr. Wadeyar has also recognized for his excellence with awards such as the Aparupa Tatha Vishishta Vaidya in Ayurveda and has been felicitated by BLE Ayurveda Mahavidyalaya for his contributions. So let us welcome Dr. Shrinivas Wadeyar, sir.
Particularly in the study and application of metallic and mineral-based formulations. We are fortunate to have you here with us, sir. A warm welcome to you.
Dr. Pradeep Agnihotri sir completed his BMS from RGUHS Bangalore at Ayurveda Mahavidyalaya, Hubli. He pursued his MD in Rasoushadhis and Vaishnavi Kalpana from DGMA MC Gadar from 2003 to 2006 with a thesis titled Preparation and Analytical Studies of Shri Siddhadharamrita Rasa and its clinical efficacy in Amavada. Dr. Agnihotri sir further achieved a PhD in Sharyatantra from RGUHS Bengaluru under the guidance of Dr. S.K. Bandigod sir, focusing on standardization of different Kshara Sutras and their clinical efficacy in Bhanadara. Dr. Agnihotri sir has 19 research publications and has presented in various international and national state level seminars. His research projects include the modified Rupa Yantra under RGUHS UG research initiatives. So with a great honor and privilege, let us welcome Dr. Pradeep.
I welcome Dr. Saurabh sir to present Tulsi Mala to our esteemed honorable dignitaries of today's session as a token of respect.
Vivechanam Suswagatam. Today we have two stalwarts dealing with Rasoushadhis. Many of our clinicians, they feel they are very much excited to practice Rasoushadhis, but there is a lot of lackiness because we are unable to understand the concepts properly. It may be the Rasoushadhis, the duration of Rasoushadhis, how they act, and everything. For that, to educate us, we have two different stalwarts. So, Pradeep Agnihotri sir will be dealing regarding the clinical aspects of the use of the Rasoushadhis in various disorders, diseases. So, privilege to sir. So, sir will have.
Sababhyam Namaha. I have been into the clinical practice since 20 years, and majorly many of the Rasoushadhis from Agarbha to Vruddha, I have been using different Rasoushadhis in different conditions. I have even seen the Ayurvedic doctors who are hesitating to prescribe Rasoushadhis in their general practices. Maybe because of many of the other uses what are being circulating in the newspapers about the toxicities. Wadeyar sir is here. His hierarchy, they know how best the Rasoushadhis can be prepared. If, according to the classics, if the Rasoushadhis are prepared, definitely, and if they are administered in a proper dose, definitely, with all confidence, you can practice it in the various conditions. It is not that it cannot be given in children. It is not that it cannot be given in a pediatric age group. It is not that it cannot be given in pregnancies. It is not that it cannot be given in Vruddha or Shrinivas. In all the conditions, different Rasoushadhis can be prescribed, different levels of pathology and with different anupanas. If we want to learn in detail about Rasoushadhis, we may need such further so many tadvidyasambhasha to learn different Rasoushadhis in different conditions. But today, we'll highlight those Rasoushadhis which are very, very common, which can be kept in the clinics commonly, and which not different conditions. These Rasoushadhis can be used. That we will focus on. The versatility of all Rasadravyas, we will have a view today. Most common thing, most common Rasoushadhis that can be kept in our clinics is the Gairika. You might all know that Gairika, very simple drug, but very fantastic drug. In various pathologies, the Gairika can be administered. Red akhar is called Kulkarni. Shodhana is also very, very simple. You can just give bhavana with duddha if you want to use it instantaneously. If you want to store it, subject it for Vrutavarjana and use it. If you do the Vrutavarjana, you can store it for a longer duration. I have heard of the Vaidyas who are using Gairika in certain emergency conditions, even without Shodhana, directly mixing it with the milk. Even that also I have seen. It gives a fantastic result. Not that Gairika is a very poisonous drug. Just mixed with milk also is sufficient. You can administer it in various conditions. Most commonly, Gairika is attributed to very good Pitta. In Pittaja Shirashudas, this is considered as a very good drug of choice. I, in my clinics, use Gairika in various conditions, like in Mukapaka. In Mukapaka, as a lepa, Gairika can be used. Not much trouble taking, just mix the Gairika with Madhu or Rutha, then apply it in the Mukha, wherever there is Mukapaka or ulcers, they can be prevented. Or the Mukapaka gets subsided soon. In many of the inflammatory conditions of the Mukhagata Rogas, the Gairika lepa is the best. Not alone Mukapaka, even the vocal mucosal inflammatory conditions, or even in the conditions of fibrosis, when there is a lot of inflammation. Application of Gairika is the best. We have tried Gairika with Gugrutika Ghrita, mixing it together, applying as a lepa in various fungal conditions of oral fungal conditions. We get a very good results there. Gairika is such a wonderful drug. Even Gairika can be administered externally in many conditions. Usually, in the layman, they do use it for herpes. In the SERPA conditions, as an application, Gairika lepa is used. One step ahead, if you mix Gairika with Vruddharashtranga. Vruddharashtranga is very, very simple drug. It is a mud-like thing. It is not given internally. It is used externally. Shodhan is also very simple. Just powder it, mix it with water and dry it. This Vruddharashtranga, when you mix with Gairika and apply it in cases of herpes, you get very wonderful results. Very quickly, the herpes inflammatory conditions get subsided, the inflammation, burning sensation that gets subsided. This is my personal experiences, what I am sharing with you. Other than this, in Udarada Kota like conditions also, we use this Gairika. In Shita Pitta especially, whenever there is a disturbances in GI flora, when the intrinsic factors get disturbed because of a lot of acidity, in such conditions, when there is poor B12 absorption, then definitely in such conditions, because of the deficiency, urticarial patches, urticarial gases to occur. To improve the flora of the gut, or to improve the intrinsic factors in the stomach, Gairika is the best. It helps in curing the ulcers of the gastric or duodenal ulcers. Thereby again the intrinsic flora is restored. The Shita Pitta Udarada like conditions can be managed well. Even to the moderate conditions of Pandu, Gairika is the best. In various conditions, like in such conditions, in GI tract conditions, Gairika is the drug of choice. Even in cases of ulcers, externally also, the Gairika can be made use of. Previous. In Vanidhan Garudas, along with coconut oil, guaiacol can be used. I told you in the inflammatory conditions or the fungal conditions of the optos or in the buccal mucosa, guaiacol with tikka has been practically tried and we have got a very good results. Similarly, in cases of bruna, guaiacol with coconut oil can be made use. Next, the other drug is Navasagara, a very simple drug which can be stored in the clinics and which can be dispensed according to your need. A simple formulation can be prepared and can be administered. So this Navasagara is explained as Atteika Chikitsa in Vrishchikadamstra. In Vrishchikadamstra, whenever there is scorpion bite, in that place, if you place Navasagara, it immediately nullifies the effect of Vrishchika Visha. Excellent first-hand medicine what can be used in Vrishchikadamstra. So in Amlapitta also, this drug is a drug of choice. Navasagara. Whenever there is a burning sensation in the epigastric region because of lot of amlata, in such conditions, if little amount of Navasagara is, Shodhita Navasagara is given, it immediately nullifies the pitta by its Kshariya nature. When Kshara mixes with the Amla, what is the product? It gets converted to Madhura. It is when Kshara is mixed with Amla Rasa, then it neutralizes the things and very immediately the burning sensation can be reduced. Even as a Atteika medicine, this Navasagara can be administered. Navasagara helps in Agnihotri. Whenever after Usthana Bhojana, if the food doesn't get digested, then Navasagara can be administered. A drug of choice which helps in kindling the digestive juice and helps in Paka Ahara. So at the same time, this Navasagara is very good. Kapha Nissaraka. You might have seen, you just look at different cough syrups. Ammonium chloride is one of the drugs there. Navasagara is one of the drugs. It helps in liquefying the mucosa in the lung. It helps in liquefying the mucus. So along with whatever the Kasahara yogas you prepare, if you add a little bit of Navasagara into it, definitely the Kapha Nissarana can be achieved very easily. A best drug in cases of Kapha Nissarana, which can be used promisingly in Kapha Kasas, in Shwasa also. Next, the other drug is Tankana. Simple method of Shodhana. Tankana. How the Shodhana is done? Varchana. Isn't it? Varchana has to be done. Then it blooms up like a flower. Utfullikarana, what the procedure is called as Utfullikarana. It blooms up like a flower. So that Tankana has wide role to play again in various therapeutics. In Mukhapaka, along with Gairika, Tankana can also be applied. Tankana along with Buddha is made as a pack in caries tooth. So whenever there is a dental caries, to fill it up, the Tankana and Buddha both are mixed together. It is made a solid mass and it is packed in dental caries. This is in dentist, eye the dentistry, this is mentioned. So that's how Tankada has different roles to play in various diseases also. In Dantaveshtagata rogas, in Mukharogas, as a labor, as a Danta Manjana, Tankada along with Gairika, along with Dhamasa can be mixed together and can be used. In hoarseness of voice, Tankada is a drug of choice. The hoarseness of voice is usually considered as kaphaja element. In such conditions, Tankada with madhu, if it is made as a lickable, definitely the hoarseness of voice, the swara bheda, can be improved. Very quickly it can be improved. Not only in the Krimidanta, even in cases of Dushta Guna, Tankada with Guda can be applied as a pack to heal the ulcers. Our Dr. Saurabh sir has tried Tankada Churna in many of the OT cases. After all different operations, very Dushta Gunas, he washes the wound with the Tankada Jala and then closes it with the beautiful results. So this is how these simple Rasoushadhis can be used in many conditions with wonderful results. So you should start exploring the Rasoushadhis, only then confidently you can use them.
So, to add on some of the things, so in the folklore practices also, we are using Gairika, especially in Visarga. We have folklore practitioners who draw something eagle or Garuda. It is not the Garuda which is acting, it is the Gairika which we draw on. Right? So, a lot of things are there. So now over to Wadeyar sir. Again, we will come back to Agnihotri sir.
गुणत्रय विभेदेन मूर्तित्रय प्रयुष्य त्रयीभूय त्रिनेत्राय त्रिलोकीपतये Very good afternoon to all of you. So you don't have any Annaklama now? Are you having any Annaklama? No. Okay. If the knowledge, a little knowledge which we have, that we are trying to share with you, if it can dispel the klama, if it can dispel the tama, then we are very fortunate. Because we have also that inside us. Raga, Viroga, Sakatana Shakta, Vishesha, Kaya, Prasata, Vishesha. They are in you, they are in me. They are not only in me, they are even in my knuckles. Raga, Viroga. So much we are equipped with such armor. Like you play various games, you get suddenly what you want. Like we have Loka, Shoka, Bhaya, Krodha, which will be performed in various karmas. First, we should all consider ourselves fortunate because we are here. And when I came here and had bhojana, I felt like studying here is going to give knowledge. That's a definite result. But along with that, what I felt is, some of our papakarmas, Adrishta papakarmas, their paka may also occur. I think Pavan sir and Agnihotri sir will agree with this. Agnihotri sir will definitely agree because he is Agnihotri. He will learn paka. Is it? Okay. So I am feeling like I should be here and you should be here. Somebody with you. Right? So this Shastra, Ayurveda Shastra is so unique. We have joined it because it is going to give a solution to all. It should produce its Midas batch. How is that possible? we need to have certain qualification. Why you joined Ayurveda? How you joined Ayurveda? Right? By an entrance exam, isn't it? You joined an entrance exam, by NEET entrance exam. But earlier also, Medhavi, says Sarvana Sundara, his guru told, the Medhavi student should join Ayurveda. Right? Didn't he join Ayurveda? Of course, Ayurveda admits everybody. Ayurveda admits who? Only Medhavi? It is Trividya Shishya Buddhi. So the student like you and me who joined Ayurveda, how was his condition? One qualification they had was, they wanted to cure the disease. At that time also, different systems of medicines were in practice. They wanted to cure by Ayurvedic medicines. Right? That's a very simple thing which you all and me also know. For that, what he did, he went to a guru and learned Ayurveda. Isn't it? Samsara yasminami pranam nana roga nika vibhutaha tratara malapamanaha chaturvarga krishyante tat guru bhuvanatro paya syadhi prashne guru pratijatnyatha darishkami athayam vyakhyasyana. Read Samhita. Go and read Samhita is meaning. People are suffering not from a disease. People are suffering from group of diseases. Right? When patients come, they say, "Sir, I have a Santikata, osteoarthritis, like bring this up, fight." Along with this, sir, no sir, I am not having sleep at all. Then we ask why you are not having sleep. Then they will tell, "No sir, I am diabetic, I am hypothyroidism." Along with that, so what is this? Nana roga nika vibhuta. So our medicine, our aushadha, whether it is, how many types of aushadha are there? Rasoushadhi, Kashtaushadhi. What will be your answer? Right? It is given in first chapter of Charaka, isn't it? Dirghan Jivati. What is given in the last part? Jangama? Parthiva. So what is Parthiva? Yes. But sir discussed, they are all Parthiva members. Now, what is the intention of all these? Right? What is the intention of all these? To provide relief. That is Dukkhatraya Abhighata. Dukkhatraya Abhighata Jitnasa. Why we are having Jitnasa here? Why we are having Jnatamicha Jitnasa? Because we are getting afflicted by various what? Various dukkha. Sufferings. We are having sufferings. But if we go into the depth of the sufferings are of three types. Adhyatmika, Adidaivika and Adibhautika. Dukkhatraya Abhighata Jitnasa. Tadapaghatake hetu drishtasa aparthasya. When somebody gives relief to this, means it is apartha. Don't do. Why are you doing this? Right? What do you mean? I will tell you in simple words. A fever case comes, he is having a relief for that. That is a paracetamol. An antibiotic he is having. Why you should treat? What is the need for us to treat? Why are we here? आपका काम क्या है? जब कोई इसको treat कर रहा है, उससे 15 मिनट में उसको sweating हो रहा है, तो what is your role? That is how we should stand in the society. When I completed my post-graduation, I did like this. I thought this process was all going on for the, let's say, joined the AMS, and during post-graduation in Jaipur, I had contact with a very good teachers like Om Prakash Upadhyay, Lakshmikant Vedi sir, and before that, our late Guruji, Chitrapadi Shrinivas, Somayaji sir. Many of you in Karnataka know him, how, what are his contributions to the Samhita Dhyayana. So with that case, why I am telling you is, see, the question is very simple. The first chapter of all Ayurveda Samhita, including Rasa Granthas and all, is Dvara. We should treat Dvara. Don't go for chronic cases, we go to that later. Because your esteem in the society, your recognition is based on the treatment of this disease. Because my friend told me, when he was doing general practice, when I started my OPD, he told, you did MD, no, you will treat big disease like hepatitis B and all, cancer and all, you will treat. But you are unable to treat Jwara, Rakta, Pitta, Kasa. They are the first chapters, no? It's very right, you are very right. Now the question comes, if you want to treat a Jwara, right, is it possible? When one system is available that is effectively treating it what they claim, what is the difference in the way we treat? Right? How different we are and what is our procedure? Are we trained Sapta Ratriyana Pachanti, Sapta Dhatu Gatamala? 7 days we are going to do Langana, isn't it? Is it like that? Yes, it is like that. But how it is to be understood? and what are my observations and how these Aushadhi, right, the 3 Aushadhis are effective in treatment, right. I will come with a small case. So it's kind of like the permission, but I will explain it. Okay. Okay, so Jvara means what? How to treat the Jvara? So to treat any condition, what you require the fundamental principles of the disease, right? So when the Jvara case comes, now whether we should give, as a student I will ask, not as a practitioner, the question comes is whether I should prescribe him a Rasoushadhi or I should prescribe him a Kashtoshadhi. What is your answer? Your choice. Some will say Kashtoshadhi. Some will say Rasoushadhi. What is the Rasoushadhi? Tribhuvana Kirti. What are the contents of Tribhuvana Kirti? Pingulam Chavisham Vivasham, Kankadam Madhadisham, Senchuram Bhavayatra, Surasarthaka Hema. So they are mediated words, Surasarthaka Hema. What are those? They are again Kashtoshadhis, right? Now you are going to do Tribhuvana Kirti directly to the patient when he comes. That is the question. Like they give an antibiotic drug directly, we are also going to give in the same way. If that is the case, then you are absolutely wrong. Right? Ayurveda Vaidya neither gives a Kashtoshadhi nor a Rasoushadhi. Both are absolutely 100% wrong. MCQ 1 mark cut plus 1/4 correction. So what's the trick? It is Langhana. Right? It is Langhana. We are not giving any Dravya here, isn't it? This is the principle. Now, you will say, sir, there are a lot of yogas in Rasa Grantha which will tell they will immediately reduce the temperature. Yes, it is told that. But have you referred what are the first line shlokas in that Rasa Grantha? You will read a lot of Rasa Granthas only for yoga. And you have to understand that also, there is a big depth. You have to dive deep. The Arogyavati which you are using today, do you know how difficult it is to understand it, the shloka? How much quantity of kudiki you are going to add? Right? Rasaganta Samasham Triphala Duram Pruktam Triphalam to Shilajit, there are like 20 to 30 formulas which are running in the market, even AFI accepts them. But what is right? That has to be identified. For that, reading the Samhita is essential. Now we want to go Tribhuvana Kirti in Jvara. We want to read the basics of the Rasashastra. The basics of the Rasashastra tell us what? They tell us that there is a very unique book called Rasabhaddhati. There are a lot of books written in the 10th to 15th century. If you really want to practice Rasoushadhis, then you have to read at least 5 to 6 textbooks. Like Charaka Sushruta and Ashtanga Wadeyar, right? You have to start Rasavadaya Tantra, then you have Rasavadaya Samuchaya, then Ayurveda Prakasha. All you have to proceed. It is not like you will take a book like Rasendra Chintamani or Rasa Tarangini, take some yogas and use them. It's not like that, right? So they are all based on Ayurvedic principles. Now this Rasabhaddhati book says Ashtanga Ayurveda Vidam. What it says? A person who knows Ashtanga Ayurveda, which is the minimum qualification of becoming a Vaidya, he should use Rasoushadhi. You got the point? So it's very clear that you have read Charaka, you have read Vakbata, then you give this medicine. It's not that you will take a medicine, rub it and give it to the patient. It's not like that, right? You got the point? It's not that the Rasoushadhis are to be administered directly. Right? There is a principle. The principles are same as that of Ayurveda. Is it? Alpamatropyogitva, Aruchirapta Sangataha, Kshipram Arogyadayitva, Aushadhi. From where it is? It is from Rasa Jaladiti. The part itself is Prakshipta. That was added in the later period. I can show you the reference in the Panduliki, which is the Asiatic Society. That shloka itself is a Prakshipta part. Right? You will understand later. Right? So it's a Prakshipta part. Means somebody added it in between. It's a 18th, 19th century book written in the later period. Right. Now coming to the point. Now, what are the principles of administering the Jvara in administration of Dravya in a Jvara? Right. Now we will go to that. Yes. You change. Okay. So we saw these lakshanas in this case. Santapa, Angavardha, Alasya, Krishna and La in a patient. Right? Santapa is what?
Dehamanu Santapa.
Dehamanu Santapa. It's a very typical lakshana of Jvara. Sarvangadeya Santapa. Next. Okay. So where it was observed? It was observed in a 31-year female. She had a history of irregular food habits. She had shifted from Bangalore to Hyderabad. She came to our OPD. Right, next. So, why Santapa is there? If a patient asks you, tells you on telephone that I have Jvara, you cannot confirm that it is Jvara. Jvarastu Ekaiva Santapa Lakshana. And if there is no Deha Santapa, you cannot tell it as Jvara. Right? Shariram Sattva Sautvyam Churyadena Ashayo. Next. Now, what is the first line of treatment in Jvara? So, we told already that it is not Aushadhi. It is Langana. It is not just Langana. Charaka says something has to be avoided. Like before doing any puja, you do Vignaharta, Pujana. Like that, something has to be avoided. Right? We conducted several camps in the rural region. There we were treating Jvara cases. Then, so what the patient used to do, there was a Jvara clinic open in a nearby place here called as population. So what the patient used to do is they used to take milk, they used to take bread, bun, and then they used to come to OP. Those who want to take treatment for Jvara, we started it, then we started getting a lot of Jvara cases there. Now what we told them is, you first come to our camp means, you do Langana. You come on empty stomach, then we are going to treat you. If you get thirst, then have Ushna Jvara. Many times it happened so, that when the patient came to us, they were free from Jvara because they have already started sweating. And our internees, in the camp, they examined, they found that already the sweat is coming. So which Tribhuvan Kirti is required? Now, which Musta is required? Because Pani Emission Dikshaja, Vimanasthan says which? Ushnajala, isn't it? Ushnajala is the first line of treatment they have mentioned. Right? So, what Charaka says is Vivechanam. So what is to be avoided? The first among the foremost is Anna. Isn't it? If they take food, then how are you going to treat that condition? So that has to be avoided. See, what I am telling you is, if you want to have success with any drug, whether it is a Rasoushadhi or a Rasoushadhi, these rules has to be followed, isn't it? Now, Saushadam cha Kriyakramam Prute. He says, now, Tatrapi Adhitasyeva Prathumam Nisheda. It's not working. Okay. So, Jvare Gandhaname Matav Upadishtam Proteka. Now, we just change that. Next. So, start with Upvasa. Any Jvara is there, first begin with Upvasa. General modality I am telling you, we come to specific in the question. So, then, what is the purpose of Langana? What is the purpose of Langana? Isn't it? You are treating what? You are treating Jvara. Jvara is what? Jvara is a Roga. And what is Roga? Rogastu? Dosha. There is a Dosha Pramana. Dosha Pramana Vishesham Apachara Vishesham. You have a Dosha Pramana. That quantity of dosha is to be reduced. Dosha are good or bad? In proper quantity, they lead to swasthya. So that increased quantity has to be decreased. Now, that's only the main aim in Chikitsa. So Langana, the Uddesha itself of Langana is Kshayam Nite Doshe. It is going to decrease. It is going to cause what? Quantitative decrease in the doshas. Isn't it? The Santapa will decrease when there is a quantitative decrease in the dosha. You got the point? So, Chutchayva Sopachayate. And the basic lakshana which you need to observe is Krishna and Sudha. What are these Krishna and Sudha? So, you are doing Langana. You have started with Upvasa. In any Jvara, you start with Upvasa. Then, the patient will say, I am having thirst, I am having Krishna. At that time, you have to give Jala. Which Jala? Ushna Jala. Or Shita in case of Pitta, there is a different Ushna Jala. To begin with, in simple terms, it is Ushna Jala. That itself is a big Aushadhi. Right? Because he has done Upvasa, that Ushna Jala is having very extraordinary qualities that they will bring this Veda. There is no need to take an antibiotic which is going to act on the hypothalamus and bring sweat to you. There is no need for it. Because that Ushna Jala and Langana itself can bring what? Svedotpatti. Isn't it? What is Langana? Upvasa is mentioned where? Upvasa is mentioned. Apart from Jvara Chikitsa, where Upvasa is mentioned? Raktadhatu. Okay, next. Dashavida? Langana. Yes, it is. Anagni Sveda. It is an Anagni Sveda. No Agni is required. Isn't it? So such extraordinary treatments have been mentioned in our Samhita Granthas because why I am telling you this, you in a cancer case you may administer an extraordinary drug, Erekavasma like that. But that also requires to cut off the supply of rasa and rakta to the what tumor and whatever you are treating. For that, it should be based on a proper upavasa vidhana. There should be a proper pada vidhana. There should be a proper ahara vidhana. If you are not doing this, if you are administering medicines, then what? Then you are using shastra. Like Dirghanjivati who has studied, you know what mistake you are doing. So don't do that. You have to begin with what? The pachana of doshas, and the best pachana is Langhana. Langhana is not just, I will come to that point, what is the importance of that. Now, Vivechanam Mahadoshasya Bhuyo Jvalayati Jvaram. Next. So in this case, we come to the next slide of the slide. We gave Musta Shunti Paniya, right? The most commonly used Musta Shunti Paniya, most of you know, right? Musta and Shunti are added in a liter of water, say 1 or 2 finger reduction we did. I am not going by the very specific Paniya Vidhanas, which is adding a large quantity of water and reducing into Ardha Shuddhatva. I am not going into the technical details of that. A very simple Vidhana of preparing Musta Shunti. Next. Next. Then, see what is the basis of administering this dravya. It is upvasa. When Krishna, you Musta Nagar Paniya, wait for Kshuda, and when there is Kshuda, you have to give what? Mudgayusha. It is Esabedekattu, what we call here. All Vaidyas in this place they used to give Esabedekattu, that is Mudgayusha in Jvara. What it is again a yoga, isn't it? But prepared from what? Ahara. So the treatment, whether it is on Rasoushadhi or Rasoushadhi, it should accompany with upvasa. It should accompany with the ahara dravya. Isn't it? So if you are giving a bhukshuda, if you are giving trivikrama rasa, if you are giving any other rasa in the case of an ashwari, what ahara you are going to administer along with that? What is that ahara? You are going to give kulatta, isn't it? So that kulatta becomes what? Pati hitat pathya. Patha means rodas. That which is hitat over rodas, that is to be given first because that knows how to travel inside the body very easily. When you talk about pharmacology and bioavailability of drugs. So what is that? Where the bioavailability is there? Principles are embedded where? In the Samhita treatment itself. Right? So coming to this. So what had happened in this case is the Jvara became Nirama in 1.5 days. Desire to eat solid food came. There will be a desire to eat food. Any food you give, says the patient. Then the patient says, give me dravahara. I cannot eat solid food. I cannot eat chapati. I can eat rice. I can take ganji. I cannot eat chapati or roti. Then comes, so the patient had a desire to eat solid food on 1.5 days. So he was given jawar roti, sorghum, the most preferred antioxidant now. It is called as jondalaka. Yes, in Bhavapraka it is called as jondalaka. So jawar the roti we call jawar ki roti. But he had weakness, and centralized food based on our appetite. Now Bala Sharira Agni got normalized in 7 days. See, only in 1.5 days the temperature reduced and she was okay with this problem. Now I will tell you what were the reports. Next. Actually, it was a case of what platelet count had reduced. On the first day it was 1.42 lakhs, it was dengue positive. Then it came to 80,000. Next. It came to 53,000. On day 6 when we did it was 1.2 lakhs. So this was all behind this. That is, it was a dengue positive case. Right? That is one thing. Leave it. They were anxious. But what happened is within 1.5 days the Jvara has become Nirama. Jvara Mukti is different, Jvara Nirama is different. Nirama Jvara Lakshanas are different. And Jvara Mukti Lakshanas are different. Papo Mukha Shavatushadhis Jvara Mukta Lakshana. Niramata is different. It is based on Mala Pravrutti, Mutra Pravrutti mainly, along with other Lakshanas, Veda Pravrutti and all. This is a very different thing. Right? After you get free from what we got temperature today, after 2 days or 3 days, again the patient says, I am getting more and more sweating, sir. They get Mukhapada. These are all Jvara Mukti Lakshana. Because Rakta Pitta Kas are different. What is Jvara? Jvara has an Agama and an Uparama. that which comes inside your body has to go out. No? You take inside and kill it. It's a different thing. It comes and it goes out. So that's a very different thing. When I get time, I will explain you. Jvara mukti is different because there is a agama of jvara. There is a agama kala of jvara. There is a mukti for jvara. What we are doing so-called the treatment because Tribhuna Kirti is only related to dosha. It's only related to dosha. You got the point. That's why when we don't treat with dosha, when we are unable to treat the doshas with Aushadhi, we go to Namna Sahasra Murdhana Charachara Patim Shubham. That's what the Agantha treatment is mentioned. Otherwise, you would have treated it only with a drug like Parishad Kashaya. Which is Agantha dosha. It's not like that. Right? Isn't it? So, the whole principles are based on what? The whole principles are based on what is the fundamental principle here? It is Lankana based treatment. Now you are having the case of Jvara. I will come to the point where in the general practice we get a Jvara case who is having severe cough. He will show a X-ray or then he will tell, sir, I am having severe Kasa, Shvasa Lakshanas are. Then what you are going to? Isn't it? Whether you should give Kasa Chikitsa which says Snehai Purvam Upachare or you are going to treat the Jvara. Isn't it? Right? So they will say it is a respiratory infection, sir. Now, in such cases, what I found was, on administering just upvasa, the malapachana completely will not happen. Now you will say, we will try another paniya. Why just depend on this mustache only? Shadanga paniya is lot other paniyas there which we have to take into consideration. Right? So, the very principle of Charaka is very important here. Now I will tell you, even if you want to administer Tribhuna Kirti, that will be effective only when you do Langana. Now in the second case, when there is Kasashvasa, are you going to administer any other dravya? It's not again the question of Kashtaushadhi or Rasoushadhi because that is not going to give you the 100%. Why? A Charaka principle has been lost here. It has to be followed. What is that? Langanam, Svedanam, Kalo, Yavakvas, Tiktako, Rasaha. The second is Svedana. How many types of Svedana are there? Right. So all Sveda you are going to administer in Jvara. Trayodasha Vidana. Right? So which is that Sveda which is indicated? Okay. So says Varbhata, so the Pina Sashvase. So Udarta Pura Kapha Purita Ura. So there is Kapha in the Ura. So the Pina Sashvase in Pinasa, that is running nose. Shvase, there is breathlessness. So in these conditions, if you do Langana, then what is going to happen? It's not going to cure completely. So another modality is required. That is the second modality, which is Sveda. So we do Sveda with what? With the help of the Falaka, right? Tawa. If you heat the tawa and then put a cloth over it, and the patient is made to sleep over it, right? I have the video of that also. Very simple technique. That is going to bring you the sweat, indicating that some amount of dosha chalana is there. Then the other medicines are effective in that condition. Even we had a case, it was case diagnosed as pneumonia. When we gave Sveda, right, Langana followed by Sveda, then we gave certain medicines like Tribhuna Kirti or Shvasakuthara after that. Then within 1.5 days, we observed that pneumotic patch has vanished. This becomes possible how? Because the Charaka principles very clearly says that Langana should be followed by Sveda. You got the point? Then comes the Paniya and Ahara Vidhana. So, what the point you want to emphasize is that when you want to treat a particular condition with a Rasoushadhi or a Kashtaushadhi, you have to follow what? As Rasapaddhati has clearly told, Ashtanga Ayurveda Vidam. The person treating with Rasoushadhi should be Ashtanga Ayurveda Vaidya. Right? Where the commentary of that Rasapaddhati says, you should read Ashtanga Hridaya. Like that he has written in the 14th century. So, beautifully they have written. It means their emphasis is on what? It is on reading the Samhitas, that is Ashtanga Hridaya Charaka and Vardhana. So, with that, we can put this small sum.
Really enjoyed it. So, you can understand the efforts behind treating the cases where we are getting without any pain. Right? Without any pain we are gaining here. And what thing is, lot of difference between the generations. Right? We people are 5G, people are 5G. Lot of things are a lot of revolution. So when we see that, we are lacking the knowledge of Samhitas. So a lot of things are there. We have taken as some, S-U-M, Samhita. Some means addition. And you people take as Samhita, S-O-M-E. It is Samhita for you, it is S-U-M. So let us join together to make it as S-U-M. It will add actually. And one more thing sir said that, why you people have chosen Ayurveda. One thing I have to say is, Ayurveda has chosen us. Yes. Lucky that Ayurveda has chosen us. Because सबके नसीब में Ayurveda है. We are not here that we have not got MBBS and they come here. It is our luck, we are in BAS. We are Ayurveda. And that if you practice, right, वो दुनिया ही अलग है. Right? So again, back to Agnihotri sir. So regarding questions and all, I am not as a moderator here. I am also a learner. Punaha Naginavayate. Everyone says about Ayurveda. And even if we hear from everyone, it is a new thing. And no doubt there are no questions here. No questions to the audience also. Right? You want everything. So try to utilize the things. Right? Utilize the Samhitas. Better make notes out of it and you can practice in your daily life. So over to Agnihotri sir.
Of course, the Rasoushadhis are to be administered. Definitely, the dosha, dushya, everything has to be studied. But that doesn't limit to assess the strength of Rasoushadhis. Rasoushadhis, when they are prepared, lot of samskaras have been explained for Rasoushadhi preparations. Different stages of Rasoushadhis are there. We have Chaturveda Kalpas of Parada. We have Puttali Kalpas in the same Chaturveda Kalpas. We have Vishadravyas. So, all these dravyas at different stages of Doshikamasas definitely can be administered. When we say that whenever there is a complete Shrotha Vrodha in the body, when no Aushadhis are able to clear these Shrotha Vrodhas, then definitely in such conditions the Vishadravyas have been explained. Among them, Mahavishya is Varsnara, and there are many other such Vishadravyas which definitely help in opening up these Shrotasas. So, for a short time when you use this Vishadravyas, when you achieve Shrota Shodhana, then again once again go back to the classical route of treatment. Even practically also we have seen such things. So similarly when we come to Chaturveda Parada Kalpas, among them one we have is Sindhura Kalpas. A simple Sindhura is just Sindhura what we have. Why these Sindhura Kalpas are different? So Sindhura Kalpas are Kupipakva Kalpas. They are supplemented preparations wherein we are heating the medicaments, heating the kajali for around 12 to 14 hours. So it takes up such a huge energy and gets sublimated. And think what energy these sindhuras have when they are prescribed to the body. If we study these sindhura preparations, he says Ashtaguna Jarit Sindhura is much more potentiated than Samaguna Jarita Sindhura. Why? Because the time taken for these sindura, Ashtamana Paridarika sinduras, to sublimate takes much more longer time. Until that large period, the para, the gandhaka in the gopi keeps on absorbing that energy from the flower. So when such sindura is prepared, it becomes atyanta sukshma, and when such sukshma dravyas are administered, they definitely become sarvyapi, clearing the Shrotavarodas with the energy what we have already supplied through in the preparation. So Rasindura is one among them, what we can keep it in our clinics, and it is a very good catalyst. Rasindura is a very good catalyst. So whenever we mix this Rasindura with any of the Rasoushadhis, the dose of the Rasoushadhis can be definitely minimized and can be administered. Instead of giving 10 grams, even reduce the dose when we add this Sindhura to it and then administer with the equivalent effects. So this is what we have seen in our clinics. The fortification process of the churnas with Rasoushadhis can be done. So Rasindura is in Shwasaritaras, as in Sharandar Samhita it is said, if a Vivechanam is being chewed along with Rasindura, it relieves Shwasa. So this was one of the thesis studies based on this was done, and very good results also was seen in case of Shwasa using this Vivechanam. So you take a Vivechanam, mix it with Khadira Kwata and the Rasindura Churna. Rasindura, you can add in it, keep it dry thoroughly, and if such can be used as achievables in Shwasa patients, definitely that is a very good relief in the Shwasa attacks. It gives a very good relief. Even in cases of apasmara along with Vachachurna or Ushmana Swarasa, Rasindura can be administered. So Rasindura takes the drug to the targeted organs very quickly and efficiently. That is how these Sindura kalpas act as a yogavahi to the targeted tissues. So by mere changing the vehicle, you can treat n number of diseases using the same drug. This is the beauty of the Rasa Yogas. Even in cases of Supta padas like numbness or diabetic neuropathic conditions, along with the Shmula Kashaya, if these Induras are administered, they have very beautiful results. In Shwasaritaras also, along with Godanti, Basma, along with Karpura Churna, if these Sinduras are administered, within a short time, very quickly the symptoms can be relieved. Definitely the respiratory immunity can be enhanced by giving such formulations. Next comes the other set of kalpas, that is Basma patients. Among them, we can go with the Abraka Basma. Among all the Basmas, the Abraka Basma and Swarna Bhasma are the Bhasmas which can be given directly. Sole use of this Bhasma can be made without any other herbal mixtures also. But for the rest of the Bhasmas, compulsorily one or the other herbal drugs are usually needed. So, but still, whenever we use the Bhasmas, if we process it with, if we mix it with herbal drugs and administer, use a very good, forms a very good formulations. So in Shvasa Klasa, usually to improve the bala of a patient, along with Abrakvasma, Haridra Khanda or Sirtopaladi Churna is usually administered. Very effective formulations in such conditions. Abrakvasma with Swarnakalpas or Swarnabhasma also as well has a very good results in delayed milestone cases, in CP cases. We have seen in elderly patients who have suffered with encephalitis and who have suffered with demyelinated nerves in the ear and vision region. The remyelination was achieved by giving these Bhasmas. So, Swarna Bhasma along with Abrak Bhasma, we have such combinations. So, when administered, the remyelination of these nerves can be achieved. This Abrak Bhasma along with the Rajata Bhasmas can be administered even in cases of PCOS. In Vaishyaja Ratnavali, we have a yoga wherein in PCOS like conditions, when in such Raja doshas, along with the Rajata Bhasma,